Hello, I'm Glenn Poole, CEO of the Australian Men's Health Forum. This is Men's Health Connected, Day 4, where we're focusing on nursing for men's health. Now we're entering into a series of lunchtime talks on male-friendly approaches to nursing. Coming up in this session, we have Faisal Sabi, we have Melissa Barrett, we have Mal Fraser. But first, we have Jenny Permazel of OzHelp. Jenny is a registered nurse and the Service Delivery Director at the OzHelp Foundation. She spent the early part of her career as a registered nurse clinician, practicing in a variety of hospital and primary care settings in Melbourne and regional country New South Wales over a 16-year period. Jenny transitioned from clinical work to the primary health sector, where she spent 13 years working in a variety of management and leadership roles in the divisions of general practice, Medicare Local Network, now known as PHNs, Primary Health Networks. In addition to her current role as OzHelp's Director of Service Delivery, where she's been since May 2019, Jenny volunteers as a crisis support worker with Lifeline Canberra. Jenny, welcome. We're very much looking forward to your talk.
Thank you, Glenn, for the introduction, and hello, everyone. I'd like to begin by acknowledging the traditional custodians of the various lands on which we all work, learn and live today, and pay my respects to their elders past and present. And I'd also like to extend that respect to Aboriginal and Torres Strait Islander peoples joining today. So welcome everyone to the Male Friendly Nursing Projects session. As Glenn said, I'm Jenny from OzHelp. Firstly, I'd like to acknowledge each of you for the interest you've shown in attending this session. Thanks for coming, and I hope you do get lunch at some stage. We want this session to be of benefit to all of you, and we recognise that some of the topics I'll mention may be difficult or painful. That's okay. We would encourage you to seek out the support of someone you trust. So a bit about the presentation for you. I'll cover why does OzHelp exist? What problem are we trying to solve? How do our programs work? Why are nurses central to our model? And then some personal stories to wrap it up before questions. Just trying to move my slides down and they don't want to go. There we go. So why does OzHelp exist? It's worth providing you all with some context around OzHelp, how and why the organisation came to be. 20 years ago this year, a young building apprentice from Canberra named David O'Brien took his own life. That same year, 3 others who were connected with the ACT building and construction industry also died by suicide. These suicides brought together David's mother and representatives from the Master Builders Association, ACT, and the CFMEU, who recognised a service gap and sought action to address the health and wellbeing of building and construction industry apprentices. And so with seed funding from the ACT government, OzHelp was born to help fill the support gap and reduce the risk of suicide. So what problem are we trying to solve? In 2021, OzHelp is still a suicide prevention organisation. We believe suicide is preventable, and our goal is to reduce the risk of suicide. Our lane is hard to reach workers nationally. They're not exclusively men, in industries like building and construction, and more recently, owner-drivers in the transport industry, where there's a higher risk of suicide as well. But the risk of preaching to the converted, when I say hard to reach, what am I actually talking about? It means people who are eligible for our services, but difficult to involve in them. It's a simple definition, but it is useful to guide us. It's our commitment at OzHelp to appeal to those who are harder to reach within high-risk industries. The hard-to-reach workers who access our services are most likely to be described as blue-collar workers who work in manual labour roles, use healthcare services less frequently or effectively than other workers, have poorer health outcomes than other workers, have low levels of tertiary education, and have low levels of general health literacy and low levels of mental health literacy. In many blue-collar workplaces, physical safety is a no-brainer nowadays, while the concept of psychological safety is only now starting to gain momentum. We're starting to be able to leverage this growing awareness of psychological safety at the employer level, which is definitely helping us to access workers on the ground. So the problem we're trying to solve is reaching workers, usually men, who wouldn't otherwise connect with services that support their health and well-being. We're a bridge to referral points such as the GP, counsellor, drug and alcohol services, for example. Our service delivery team includes nurses, wellbeing support workers, and counsellors. So how do our programs work? We focus on health and wellbeing using an upstream approach that enables people to keep themselves well through the inevitable challenges and curveballs that life delivers. We're able to quickly generate trust and engage with hard-to-reach workers to raise their awareness and interest in wellbeing factors in their lives, and accordingly facilitate both self-directed action and pathways to utilisation of more specialist services. Though our staff are all equipped to safely and competently manage imminent suicide risk using the Living Works model taught through the Applied Suicide Intervention Training, better known as ASSIST, our emphasis is on prevention and early intervention. I'm going to tell you about our health screen tune-ups for tradies and truck drivers, currently the two main industries we focus on. In the ACT especially, our tune-up vans are well known in building and construction, and our brand is trusted. A tune-up is a health screen that measures workers' health and recommends small actions that they can take to improve parts of their health, both physical and mental. We take our tune-up vans to building sites very early in the morning and set up for the day, having pre-booked a list of workers who will attend at a specified time for their tune-up. More recently, we've worked with truck drivers and will go to where they are. Busy road stops like Tarcutta and Marulam, if you're familiar with those in New South Wales. Today, we have two teams, a nurse and a wellbeing support worker in each team, providing tune-ups for truck drivers attending the Brisbane Truck Show. This is under the banner of Health in Gear, one of AusHelp's projects. The tune-up has recently been remodelled in collaboration with the University of Wollongong. It was reviewed last year and the scientific basis needed to be strengthened and updated. Sleep, an important wellbeing factor, was absent, for example, so we needed to address that, among other things. In addition, truck drivers told us the tune-up needed to be shorter to fit with their work lives, which are literally lived down to the minute. We needed to take it from 20 minutes to 10. Challenge accepted. The tune-up team consists of a nurse and a wellbeing support worker working closely together as a tag team. Each conducts a specific component of the tune-up, building trust and rapport with clients and asking standardised questions across a number of domains. A tune-up asks questions about how the worker describes themselves, health conditions they currently have or have had in the past, their general physical and mental health, cholesterol, blood pressure, height, weight, sleep, exercise, and diet. Each answer to a tune-up question is scored, and depending on the score, may result in recommendations which are prioritised by the client and then discussed. The aim, all within 10 minutes, is to agree what will work for the client to follow through on the 3 recommendations most important to them. So the purpose of the tune-up is to build a relationship that can be followed up after the tune-up to check whether the client might benefit from a recommendation and to motivate the client to follow the recommendation. For example, a GP appointment, AusHelp support appointment, or the wellness information tip sheets on the Health in Gear and AusHelp websites, for example. We send a follow-up email 24 hours after the tune-up, providing a soft copy of the recommendations and asking, is there anything from the tune-up that can be better explained? And is there anything from the tune-up that we can help with? Where clients have provided their consent, a further follow-up is undertaken after 3 weeks. The remodel tune-up is currently undergoing pilot testing through the University of Wollongong. So why are nurses central to our model? In the Roy Morgan Image of Professions Survey 2017, 94% of Australians rated nurses very high or high for their ethics and honesty. Nurses topped the annual survey for 23 years running, having been first included in 1994. And AusHelp's experience bears this out. The hard-to-reach workers we want to connect with are interested in having a health check with a nurse. We've learned to sequence the nurses part of the tune-up after the wellbeing support team members part. Otherwise, our tradies are likely to say, I don't need that part, it's all good. And they disappear back to the tools with their cholesterol results in hand to compare with their mates. Outreach and engagement are core capabilities at AusHelp. A core skill every AusHelper in the service delivery team needs, including the nurses, is to rapidly connect with clients. Without this connection, a conversation goes nowhere. We have a deep understanding of the industries we support and the needs of their workforce. Part of the recipe that helps our nurses connect with clients is being relatable. They've completed asbestos awareness and white card work health and safety training. They wear high-vis, steel caps and hard hats on site. They know the typical industry stressors well, and they barely notice the odd F-bomb, all part of a day's work. They're authentic, compassionate humans who thrive at the coalface. Our nurses either have or are working towards Certificate 4 in mental health as a minimum, in addition to their nursing qualifications. They complete a range of other training, including trauma-informed care, domestic and family violence, assist, as I mentioned earlier, to safer care for anyone with imminent risk, mental health first aid, and our annual in-house series, which covers reflective practice, client autonomy, reflective listening, empathy, questioning, whole person conversation, assessing risk, responding to challenging behaviours, and importantly, self-care. Each of our 2-hour in-house sessions has a corresponding workbook so that new staff or anyone wishing to complete a refresher before the next face-to-face update is delivered can complete some self-paced learning. As is required by law, our enrolled nurses are indirectly supervised by a registered nurse for support in relation to the clinical nursing components of their role. Along with our wellbeing support workers, the nurses also participate in monthly external supervision, which is provided by an experienced counsellor. This provides a safe and confidential environment for the nurses to debrief regarding the support component of their role, to be challenged regarding their own personal processes relevant to their work, to be invited to explore and examine the effectiveness of the professional skills and approaches being used, and be invited to consider alternate evidence-based therapeutic pathways, to receive relevant theoretical input on clinical and ethical issues, therapeutic models and current best practice, to provide specific training from the brief and strengths-based approach to support that we use, and to identify areas of their expertise that could benefit from further development. To further develop and refine the skills that are used in AusHelp's support approach, along with our wellbeing support workers, our nurses participate in quarterly call coaching sessions with our senior counsellor. With a client's consent, a support call is recorded and used as a reflective practice before being deleted to identify areas for improvement, tips for different ways to frame a conversation, and to celebrate skills. Some personal tune-up stories. So not a randomised control trial, but some personal stories direct from tune-up participants, just to bring the kinds of things that we see happening all the time a bit more to life for you. So in the first story, a male construction worker in his 40s attended a tune-up in late 2019 where it was identified his health would improve if he quit smoking, reduced his stress and improved his diet. After the tune-up, the client succeeded in quitting smoking with the support of a mate and also started eating more fruit and vegetables. These changes resulted in him feeling more energetic and healthier. He stated he felt more confident in dealing with work stress and the greater responsibilities that were now part of his role. So again, this well-being concept that we believe in. Another male construction worker attended tune-ups 10 years apart. After the initial tune-up, the client felt he needed to make some lifestyle changes, including losing some weight. He knew the sedentary nature of his work driving trucks was impacting his health and felt motivated to change after the tune-up. By including more exercise in his schedule and eating a healthy diet, the client reached his weight loss goal. At the second tune-up 10 years later, he reported feeling awesome, having more energy, and not being lazy getting up anymore. And the last personal story, in a tune-up completed in early 2020, this male in his 40s self-reported that he was struggling with work stress and poor sleep. He felt that he was not able to switch off at the end of each workday and his sleep was being impacted as a result. The resultant fatigue was contributing to poor overall well-being. We worked with the client's strengths to find ways to help him switch off at the end of the day. He elected to try meditation using an app for guidance. When AusHelp followed up after a few weeks, the client reported his strategy was working and he was sleeping much better. The same client participated in another tune-up later in 2020 and was still doing very well at that time. He reported he'd formed a habit of daily meditation and used meditation at other times as well to maintain his well-being. We've learned that having nurses in our team is key to reaching and engaging with blue-collar workers in high-risk industries. I hope you've learned some interesting points and learned something new through this presentation, and I'd be more than happy to take some questions if there are any.
Thanks, Jenny. That was a great insight into the work of AusHelp. We haven't got much time, so just one quick question for me, but do stick around and check the chat box and see if there's any questions in there. What's the difference between getting a tune-up in the workplace and a tune-up at your GPs? Why can't these blokes just go to their doctors and get a check? Why do we have to go to them?
Look, I think if they would go to their doctors, that'd be great, Glenn. I think that one of the things about the hard to reach people that we try to connect with is that they typically don't go to their GP or anyone else. They may not have even had a conversation with anyone, including themselves, in their life about issues that are affecting them. Yeah. Probably the most common referral pathway for us is to the GP, because we believe that physical health underpins well-being, and really that needs to be right and needs to be checked out. I think as well, people can sometimes feel when they're visiting a GP, they've got a 10-minute slot, they've got to deal with whatever the presenting issue is on the day, and they don't get asked the very carefully constructed questions that we ask that are going to elicit responses around not just physical health, but mental health, relationships, whatever else might be going on for a person at that time in their life.
Yeah, and I think that reinforces one of the key points that's coming out from all of these sessions is the value of nurses in being able to build relationship and rapport and have those side conversations which maybe you don't have time for in a 5 or 10 minute GP session. So great talk, great work AusHelp are doing. You've been around for many years and always great to catch up with the latest news from AusHelp. Thanks for being here. do stick around and chat in the chat box if you can. Well, we're going to hand over now to another fantastic nurse who's got some of his work to share. Mal Fraser, personal friend of Men's Health and the Australian Men's Health Forum. I can't read all the letters after your name, Mal, if that's okay. But I want to acknowledge you have got lots of letters after your name. Highly qualified clinical nurse at Atherton Community Health, with an absolute passion for men's health, and in particular the needs of men in rural communities, a long-term member of the Australian Men's Health Forum, always to be seen around our events and gatherings, sharing his wisdom, always keen to learn more, always keen to be engaged in conversation about men's health. And his current work focuses on ways to improve access and engagement of men with the healthcare system while encouraging male-friendly health services. Mal, thanks for being here. The floor's yours, my friend.
Hello. Okay, thanks, Glenn. Yeah, lovely to be here and participating again in Men's Health Connected. I might just have to have step me through setting up the PowerPoint presentation.
Hi, Mel. Yeah, Merlin here. So if you just hit the share screen button at the bottom, and make sure you follow across to the PowerPoint selection. So it'll say desktop 1, desktop 2, and then there'll be a PowerPoint. Yep, click on that one and then hit share.
How's that look?
I think you've hit the desktop one because we can see the presentation.
Just try restarting the presentation just really. Oh, okay.
Sorry, share. How's that look?
Much better.
All right. Yeah, thanks very much. And again, great to be here. I think last year's Men's Health Connected was so successful, and it's great to see you rolling it out again. And congratulations on the hard work Men's Health Forum and being involved in delivering it. First of all, yes, I certainly want to acknowledge, there we are, acknowledge the traditional custodians of the land on which these events are taking place today, and pay my respects to elders past, present, and future. This has been a collaborative effort, and I want to stress today that I represent an amazing team. And you can see in the slide, Kelly, who's our unit manager, who herself is passionate about men's health, and I really appreciate the support she provides to the team and to our service in ensuring that men's health stays on the agenda. I also wanted to recognise our small team who've come in and out of the program that I'm about to talk about, Ainsley and Chrissy and Deb Gillespie from Tablelands Regional Council, who had the enthusiasm at the beginning of this program to come and approach us. So I just want to make an acknowledgement to them in particular. The multidisciplinary team have worked really well together in the combination of nurses, exercise physiologists, community development officer, Megan, who has been instrumental with the regional council and passionate about health promotion, and particularly the leadership from the men's health, or the men's shed as well in Atherton, John and Rod. So having mentioned the important people in the program, I want to talk us through the idea and how it came about. So the Tablelands Regional Council approached Atherton Community Health, advising that they had a small amount of money available to deliver a sustainable health promotion program to a high needs group in our community. They were aware that Atherton Community Health already had a long established relationship with the men's shed, and they were keen to know if they might be interested. Community Health and the men's shed in the past had tossed around some ideas about some sort of physical activity program. So, yeah, we convened a meeting. In the past, Atherton Community Health have delivered successful health promotion activities and initiatives with the Men's Shed. So it seemed like an opportunity to build on past successes. We're now in our third year of writing a health report in the Men's Shed monthly newsletter, and the Men's Shed have been key stakeholders in our Men's Health Week and Movember activities. So it was a well-established partnership, and we were keen to be involved, and certainly the Shed were keen to be involved as well. As a male nurse, I visit the Shed regularly. I feel like part of the furniture, in fact, and I must mention I feel I need to be careful sometimes saying that, as if you go to the Men's Shed and say you're part of the furniture, you're liable to get a job number and a coat of varnish. But we've had a long established relationship, and it's great to be continuing that in a different format. So our plan, the four organisations came together to nut out how best to deliver the program. And in the initial stages, as you can see from that slide, it was all very serious. We were talking about health outcomes and how we might deliver this program. But over time, it tended to soften a little bit, and our goal was to ensure that the program was fun and engaging. We undertook a pre-assessment of height, weight, blood pressure, pulse, and waist circumference. And at that pre-assessment, we identified any pre-existing conditions. So given the cohort of the fellows we were working with, obviously many of them had conditions such as arthritis, heart disease, diabetes, and that was all listed as part of this initial pre-assessment program. Then the plan was to start everyone on a generic exercise program and then modify it as the weeks passed. We set it up to have 2 8-week, semesters or sessions with a break in the middle over Easter. The men nominated their starting time, and there was a fair amount of discussion around what time we should start. Some of the fellas said, any time around 8 or 9 was too much, like getting out of bed too early. They wanted it later. Some of the other fellas said, well, for them, it was the middle of the day. But we settled on 8:30 a.m. And we certainly, as one of our planning goals, wanted to embed healthy behaviours. And the Shed taking ownership for the program, that was important to all of us, that this was something that was sustainable and that we could hand over to them at the end of the 16 weeks. In Atherton, there's a age-friendly exercise park, which is a council initiative. And it was wonderful to have Carla Barletta, who runs the FNQ Health and Fitness, our exercise physiologist, engaged in this program, because Carla actually designed the exercise or the age-friendly exercise park that you can see in that slide. There are about 60 to 70 guys who are registered members of the Men's Shed in Atherton currently, and we expected probably an uptake of about 10 to 12 fellas. We had to consider in the planning staffing it, and we thought that 3 people across the 3 or 4 organisations might be enough. So that would involve a nurse, either myself or Ainsley or Chrissy, or one of the other staff members, Kelly, along with the exercise physiologist and the health promotion officer. So we thought 3 might be enough to cover off to monitor the 12 guys as they went through the program. So the launch, that was a fantastic event. Councillor Bernie Wills one of the local councillors at the Tablelands Regional Council, who has the health portfolio, was very passionate about it, keen to be involved and excited that we were running and facilitating a program of this type. We had TV, radio, newspaper, and the Cairns and Hinterland Hospital Health Service Facebook featured. Well, 30 guys registered for the program, and we were astonished. Yeah. We then had interest from other community groups, such as the cyclists. There's a local cycling group, and some other men's group, and just general people in the community who got word about the program and wanted to be involved. And in fact, we had to cap the numbers. Megan had to find more of the welcome kits that had giveaways and goodies and more backpacks for them. So we were running around busily trying to organise that so that we could hand them out at the launch. So the rollout, how does it all run? So we start with the guys meeting at about 8 a.m, but they're so enthusiastic, they're often there at 7:45, opening up and ready to record and take their own blood pressure. They do their own BP, they take their own pulse rate, and there's a sign-on sheet that they fill in. We then review any of these recordings, look out for anything that might be adverse or unusual before commencing the exercise routine for the day. And sometimes the guys will actually let us know if they've got any new ailments or health concerns from the previous week. And that's often helpful for us when Carla or I or one of the other healthcare teams is supervising their exercise activities. So we do a 4 to 5 minute Tai Chi warm-up. We then have 13 stations, and you can see in the slide some of the stations and Carla there exercise or demonstrating how the exercises and how the apparatus are utilised. We swap after about 30 seconds, and over time we've gradually increased the increments up to around about 45 seconds or a minute, and sometimes we aim to do 2 complete circuits of the stations. And I think really importantly, with 3 of us being there, we have the opportunity to have what we call a roving reporter, checking in on the guys, taking notes and ensuring that they feel supported. So the roving reporter will ask questions, we'll just mingle, chat to the fellas while the exercises are underway, and gauge if anyone's having any difficulties exercising within their limits or if they've got any particular concerns. So on average, around 20 guys turn up. We've had a maximum of 27 guys, and on a cold, rainy, windy day just before Easter, we only had 8 fellas turn up. But we do have a contingency with an indoor hall that's provided by the council, so that if the weather's inclement, we can go there and we're out. We can still have the exercise activities and not be subjected to the elements. So I think that's been a really positive alternative that we've been able to offer. The guys can pick and choose and avoid particular stations that they might feel uncomfortable with. So they have obviously a range of ailments, and Carla is continually monitoring that and ensuring that they don't participate perhaps in activities that might be injurious to them. So we keep a close watch on that. We do have a dress code, although this is fairly relaxed and flexible. And throughout the stations or the sequence, we have regular water, relaxation breaks to maintain hydration and comfort. So how's it all going? Well, we're up to week 13 now. We have used the alternative venue 3 times so far, Marylands Hall, because the weather's been dodgy. Far North Queensland, we're in the tropics, we're in the tablelands, so it's quite predictable that we were going to get some wet weather, some wild and windy weather through the wet season. So I think that's been a really important, I guess, alternative that we can offer the fellas so that there's no break in continuity. We had music with some modern or not so modern music to create a bit of atmosphere, a bit of ambience. There is certainly lots of banter and a real atmosphere of having fun. At the midway point, we used a survey modified from My Health for Life just to garnish some of the thoughts and attitudes towards exercise, diet, fitness, and healthy habits. And we've got some interesting feedback from the fellas about their opinions towards these sorts of things in the early stages of the program. And we'll do a final survey at the end of the 16 weeks and look at how those attitudes or habits might have changed. So the blokes, this is some slides from the program in action, and you can see certainly the looks on the faces of the fellas have changed since that initial serious sort of meeting and planning. There's a smile on everyone's face, and we certainly have a lot of fun. And I think that, well, I know the guys have a lot of fun. And I just want to bring your attention to the chappie in the bottom right-hand corner with the checkered shirt. That's Colin. And I know Colin was happy for me to share his experience. He's an elderly chap, as you can see, who belongs to the shed, but has significantly advanced arthritis. So the limits to what he can do, or there's significant limits to what he can do in terms of exercise, and we still encourage him to participate in the program. But for Colin, he walks up to from the men's shed to the exercise park. It's probably about 15 metres. He participates in the warm-up to a limited degree. He mingles and chats with the fellows. And for him, it's quite an important part of his week, something he looks forward to. And the social contact and feeling part of the group has really had a significant benefit for him in particular. He's a retired train driver, so we often get stories about trains and his experience. So it's a really good opportunity for him to share some time, but also to feel part of the group. And he was keen for me to share his personal experience. So what have the challenges been? Of course, with a program like this, there are things that we certainly need to keep in mind and we need to have prepared for, so that we can ensure that the program rolls out effectively without too many hiccups. So obviously COVID was a problem. So we have strict hygiene measures and wiping down of the apparatus between each rotation, hand gel, social distancing, and hygiene is of the most importance. The guys tend to drop in and drop out. So turn up some weeks, not turn up other weeks, and that's fine. We made that very clear in the planning that we were happy for that to take that approach. We were worried that some guys might feel embarrassed because it's in a public place, and with all respect, there are different shapes and sizes, but we've found quite the contrary. I think they're proud of being seen by other folk who are out doing their daily exercise, And I think they feel proud to belong to this group and certainly feel proud to be part of the men's shed. Unfortunately, vandalism's been something that we hadn't anticipated in the early days, but the exercise park has succumbed to some of that, and we're looking at some ways that we might be able to mitigate that. And then staff support as part of a health service. We have significant demand on resources, so we had to be conscious of competing priorities. But I must say, with the support of our other clinical nurses, with Kelly, with Chrissy, with Ainsley, we've been able to have staff there every session on the Wednesday, and folk are putting their hand up to be part of that. No, we're really grateful for their participation and support.
Mal,
yes,
just a minute to wrap up, please.
Yep, wrapping up. So what have the benefits been? They've exceeded our expectations, certainly built on existing relationships, early evidence of improved health and fitness. The men have learnt new skills and awareness. They're now taking their own BP, and they know what is a good BP, an okay BP, what's normal and abnormal. You guys have joined the shed, and new friendships and relationships have been established. And they're certainly more aware of managing their own health. So the future, with the future, further evaluation and analysis of the data, we will hand over the program to the men's shed in the next couple of weeks, and they will take ownership of it. It can be modified, and what we're hoping is that other sheds will be able to take up this program and use it themselves. And introduction of new low impact exercise and fall prevention strategies such as Tai Chi. The key elements, we think, multidisciplinary team approach with nurses involved, built on a strong relationship of trust, clear yet flexible expectations. Humour and banter have obviously been a key ingredient. We have a Guess the Legs comp, which is still not been resolved yet. No winners as yet. A balance between structure and being relaxed. I think being close proximity to the shed is helpful, and importantly, the men's shed owning the program.
That's brilliant.
That's our Atherton Men's Shed physical activity program, and thanks to the team.
Oh, Mal, great work. You're going to have to take questions in the chat box. We've got to move on, but I just want to say, in terms of all the challenges you've had, isn't it great that when one of the challenges you have is that you have too many people, too many blokes signed up, and you have to go and get more welcome kits? It demonstrates that you're really onto something there. So great work, Mal. Thanks for sharing it.
Thank you, Mel. Fantastic work.
Yeah.
So
Thank you.
Pick up the questions in the chat box as we move on to our third speaker in these lunchtime talks about male-friendly approaches to nursing. Coming now to Melissa Hadley Barrett. Melissa was trained as a nurse practitioner at Curtin University and has continued to keep studying since finishing her initial qualification last century, way back in 1995. Who remembers the 90s? She was a Master's of Nursing and postgraduate qualifications she has in sexology, midwifery, diabetes, and wound care. She's worked in private practice since 2012. I'm going to cut her bio short, but I have to say this bit because I love saying this out loud. She is co-presenter and author of, wait for it, folks, the Penis Project podcast. That's www.thepenisproject.org. And that's org for organization, in case you had any doubt, which covers everything you wanted to know about men's health, but we're afraid to ask. Melissa, thanks for being here. The floor is yours.
Thank you. Thank you very much for having me.
You're very welcome.
Now, just checking, can you see my screen? Yeah, you can see my screen?
Yeah, we can see your screen, Melissa. Thank you.
Great. Okay. So hello, today I'm going to talk to you about initiatives that are nurse-led for men's health, but also a little bit about nurse and physio collaboration. So I am going to talk about the Penis Project, and I wish I had $1 for every time I got to say the word penis, to be honest. So a little bit about me. You've done a pretty good job of wrapping that up, but I'm a clinical sexologist and a nurse practitioner. And so basically the way I came to this, the most common question I get asked is, how on earth did I get to have this kind of strange title? And basically I was a remote area nurse for a very long time, about 15 years. And in that environment, I came across a lot of families, and a lot of issues are around sex, money, and children. And I can't help people with their children, and I certainly can't help them with their finances, but I can help them with their sex life. And I just felt like it was a really missing space. And it's something that particularly men don't talk about a lot, but they joke about a lot, but they don't talk about in a meaningful way. So I went off and became a sexologist as well. And now this is my main area of specialty. And I am, I'm really passionate about it, and particularly men's health, because I just feel like there's such an unmet need there. So the biggest problem that I come across is that I think men don't talk to their mates or their health professionals about their private issues. As I said, they often joke about it, but they don't actually talk about it very openly. And often I find men that have been in really long-term relationships, even don't talk to their partner about it, because they feel like this is a real, we all have things that we don't want to talk to everyone about. And even guys I see have been married for 30 years, and when their function changes, they feel really awkward and embarrassed about mentioning that to their partner. So avoidance becomes an issue on both sides rather than talking about the issue. So I think that the solution to this problem is that we need to create safe places for men to talk to their health professionals and other people about this. So why do I think nurses are good for this job? Basically because nurses have been ranked as the #1 by the Gallup poll most honest and ethical profession. So I think that's pretty amazing. And when they did a survey in Australia, they found that 94% of Australians trusted nurses very high or high. So I think that, nurses are generally seen as empathetic. A lot of men will have a family member who's been a nurse. And so I just think that it's a profession that probably is easier to talk to than your average doctor. Obviously, over the last 20 years, a lot of things has changed. Google has completely been around in the last 20 years, and it's completely transformed the internet. We now have Bumble, Tinder, Grindr, podcasts, all sorts of amazing things have happened to get information out there. Our attitudes to sexuality have changed a lot. So, we now have gay marriage, and, talking about transgender and gender fluidity is such a normal thing nowadays. So there's been a lot of changes in these areas in sexuality, particularly since I started working in this field. However, not many things have changed in men's health, unfortunately. So I don't know if most people here are probably old enough to remember the old Norm on the Life Be In It ads. And, Norm was this fat, overweight bloke with a beer in his hand. And, I'm afraid that men's health hasn't changed that much. Women's health has come a lot further than men's health. And so I think this is really important. So, 1 in 7 men in Australia will suffer from some sort of prostate problem after 40 years of age. And 1 in 5 men over 40 years of age have problems getting or keeping an erection. And, I think penile function is so important for men. It's attached to their masculinity and their confidence and all of those things. And so if we can help men in this area, then we can help them with their mental health and a lot of other issues. So I'm going to mainly concentrate on erectile dysfunction in this initiatives that I'm going to talk about, but it really does affect your quality of life. So 1 in 3 men who have erectile dysfunction will also suffer depression, and the reverse is also true. 3 out of, for every 3 men that have erectile dysfunction, 1 of them will be seriously depressed. So, and most guys, it takes greater than 2 years for them to even mention it or talk about it. And I see this a lot in my experience. Like, I see guys that have had just been diagnosed with prostate cancer, and when I talk to them about their erectile function over the last few years, they'll often say, actually, it has gone off a bit, but I kind of was too embarrassed to talk to anyone about it. And this has just been a way to open the conversation. So I think the other important message we need to get out for men is that erectile dysfunction shouldn't be just regarded as a quality of life issue or something that we just have to put up with as we get older, because it can often be a warning sign for cardiovascular disease. So we always talk, Joe and I talk about a lot about this in the podcast, that, you know, the penis is like the canary down the mine shaft. If the canary dies from the bad oxygen, the bad gases down there, then, you know, then we get it out and we get all the people out. Well, if your penis stops performing, then quite often that's a warning sign that your heart might not be doing as well as you like. So I think that's an even more important reason for guys to talk to their health professionals about their erections, because that's a big warning sign. And, you know, most GPs will go, wow, if you're having problems with your erections, we're not just going to write you a script for something to fix that. We need to make sure your heart is functioning well as well. So, as I said before, sexual dysfunction is very common. And interestingly enough, it's even more common in people following cancer treatment. So up to 80% of men and women have sexual dysfunction following that, and up to 50% of the general population actually have it, and it's even greater in depressed people. So this is an interesting pie graph, I think. This is talking about men. There was 1,000 men in this study, or just over, with severe to moderate ED, and this is only 29% of them actually admitted to speaking to their health professional about it. So out of the 1,000 guys in this study, 70% of them had this problem, and moderate to severe. So they had severe, and they wouldn't talk to their health professional about it. And so we really need to break down this barrier. So I really like this cartoon. I think this is really common. Now, there's the guy, he's gone to the doctor. He's probably telling him that he's got a stubbed toe or something. And really all he wants is someone to ask him about his penis. And the doctor's going, oh God, you know, if there's a problem, I hope he mentions it, 'cause I don't want to talk about it. So any health professionals out there, find a way to ask about this question. And if you feel uncomfortable asking straight out, then I think the obvious thing is, might think it's weird, but I'm going to ask you about your erections because it's actually a warning sign for heart disease. So don't think I'm a weirdo. So it's a good way to approach this problem. And I've experienced this, you know, I do work in general practice too, still a couple of days a week. And, you know, obviously my specialty is sexuality, so it's easier for me to ask about it when someone comes for that kind of consult. But even in general practice, I can say to a patient, hey, how about it? You know, I'm worried about your heart, so can you tell me about your erections? So I've got two solutions to this problem that we've come up with. The first one is what I've just created. It's called it's a penile rehabilitation program. Now this one is the first one that I'm going to bring out, and it'll be available in about 2 weeks, and it's finished. It's just out with about 9 of my patients at the moment getting tested and for feedback. But basically this program is for men who have been diagnosed with prostate cancer. And obviously when you have treatments for prostate cancer, you end up with some sexual function problems. And so this is rehabilitation and prehabilitation, so men can be informed, educated about this. And there's not many people around dealing in this area. So this is a fully online program, which will be available for people in the country, in the city. Hopefully, if you're a bit shy and you don't want to talk to your health professional face-to-face about it, you can get online and do a self-directed course and learn everything you need to know about your penis. So this program has 7 modules. The first one is teaching you, most guys don't even know how their penis works, and why would you? When everything's working normally, you don't care about it, and then suddenly when it breaks down, it's like, well, why isn't that working anymore? So the first one is teaching in very basic, you know, normal language about how your penis works and why it does. Then what you can do in prehabilitation to prepare before you start your treatment. Then rehab, like all the steps of when to start using a penis pump and why you use one, and why you should be taking a medication like Viagra or Cialis daily just to keep a bit of blood flow in there. Module 4 is for the eager beavers, which is for guys who don't want to wait the time for their function to come back after treatment. So that's talking about other options to get erections, such as vacuum pumps, injection therapies. You know, lots of people are really scared about using injections, but they work fantastic. And no one believes me when I say this, and every guy in the audience is probably cringing unless they've tried it, but there really is no pain with these injections. So there's a lot of information in there about that. Then we talk about, there is negatives to doing rehabilitation. And the biggest negative I see is that men will say to me, I feel like I'm so focused on my penis all the time. I get up every day and I use a pump and I'm always thinking about it, which is kind of highlighting it. So I talk about that, ways to deal with it, and survivorship, how to keep cancer away. We talk about diet, exercise, the importance of moving, the importance of relationships and communicating with your partner. And in that section as well, there's a bit about for partners particularly, like how do you deal with this situation? Because I often find partners will say to me when I speak to them privately, oh, I tell my male partner that's just been diagnosed, I don't care if we never have sex again, but it's not actually true. I just want to make them feel better. And then he feels as though they're not really interested, and they are. And I just think communication is such an important thing for both parties. Everyone's trying to be kind to each other, but they're actually missing the important conversation they need to have. Does that, oh, it's okay. There's another thing. This is there is also a group that I've started with the Penile Rehabilitation Program called the Willy Whisperers. The Willy Whisperers is a closed group for anybody that's undergoing penile rehab, and they can get in and talk to each other, talk to their mates, make new friends, and be anonymous. They can give themselves a funny name if they want to, and they can ask questions and chat to other people who are going through the same experience, because I think it's all very well for health professionals like me or Joe to tell people what they should be doing and why, but it's a very different story when you can speak to someone who's having the same experience that you are. Then the second solution to this problem of men not talking about these issues is a nurse and a physio-led solution. And I think I'd really like to raise the thing here about the subject that it's so important for different health professionals to collaborate. So I think it's really important for nurses to collaborate with allied health. It's really important for us to collaborate with surgeons. It's just invaluable for patients if all of the different health professionals are working together in a cohesive way instead of just living in silos and doing their own thing. So the Penis Project podcast came about because Joe and I were a bit bored in COVID, and we got chatting in the corridor one day and we're like, how can we get these stories out to other men? And what we both did before was we'd often hook guys up with each other who had the same issue so they could talk on the phone. But this way now we're up to episode 33 yesterday, and we've interviewed lots of men with not just prostate cancer issues, testicular cancer, continence issues, premature ejaculation. We've interviewed psychologists, we've interviewed wives of men who have been through penis problems. And we've interviewed a lady who's coming out in a couple of weeks who was married to a man who came out as gay after 25 years and 3 children. So it's been fantastic. I think Joe and I have both learned a lot from the patients, and we've got over 17,000 subscribers now, and we only started in September last year. So obviously penis problems is a popular subject. So yeah, so that's been fantastic. And I just think it's a really good way. The comments we get through emails are often, it's so nice to hear that Joe has the same problem as me. I thought I was alone. So I think that's just invaluable for people to listen to other people's stories. And so I'm almost at the end, but yeah, relationships and sex and intimacy are really important. And the World Health Organization has actually listed having a healthy sex life as one of the cornerstones, along with having shelter and food and water. So if the World Health Organization thinks that having a healthy sex life and having a safe sex life is that important along with food and water, then I think that we can all stop being embarrassed that we actually need to have a healthy, intimate life and get on with making it work for us. It's good for your relationships, it's great for your mental health, and it gets your adrenaline pumping and your muscles moving. So I really feel sad when I hear men and women say to me, oh, I'm 55, 60, 70, 80, and I suppose, I should just give up on this now. Because no, you shouldn't. Why should you give up? You're never too old. So if you're interested in getting on the mailing list for when the course first comes out, you can send me an email, or you can go to rshealth.com.au and send us an email and register your interest. You can also subscribe there, and I have weekly blogs come out. I have guest blog posts written by patients who, one of them in particular, he calls himself Testicle, and he writes brilliant blogs. He's a very entertaining man. So it's worth getting on there just for those. And we send other emails out with information and what's happening. And if you go to thepenisproject.org, and it wasn't organisation, it was organ, So yeah, if you get on there, then you can subscribe to the podcast and you'll get an email every week that will tell you what's on and the show notes and give you a really easy way to listen. But if you want to listen to it on your phone, then you can, it's on Apple Podcasts, Spotify, Podbean, but all the information's on that website of how to listen to it. And for people who haven't ever listened to podcasts before, there's step-by-step instructions of what to do. So yeah, so they're the two nurse and physio-led solutions that I think will really help men start talking about this difficult conversation. And I encourage you all to please, next time you're at your GP and you really want to talk about your erections, tell them you're worried about your heart if you're too embarrassed to talk about your penis. Thank you for having me.
That's beautiful, Melissa. We've only got just over 20 minutes left of this session, so I'm going to ask you to pick up any questions in the chat box, but leave us with this rhetorical question, which is this. When is it okay to sit on your computer during work hours looking at lots of pictures of penises? That's the rhetorical question. Thank you, Melissa. That's awesome. I'm going to check out your podcast and your website. I hope others do the same too.
Great. Thank you very much for having me.
You're very welcome, Melissa. Do stick around and enjoy the chat.
Will do.
So moving on now to Faisal Sabi. I made a joke about Melissa qualifying back in the 1990s in the last century. It was 1995. And that was the year we actually had the very first National Men's Health Gathering in Melbourne. It's an extension of the Men's Health Gathering, which has been going for 26 years. Every now and then, you meet someone who attended some of those early gatherings in the 90s. There aren't many of them left these days, and certainly not still in the profession, but Faisal is one of them. Faisal Sabi, he is a registered nurse. He currently works as a diabetes educator in general practice and is a nurse health advisory member of Healthy Male. Faisal's been in the room, I think, every day this week, so he's been a regular attendee, making lots of contributions from the comments section, particularly coming from the perspective of advocating for culturally and linguistically diverse communities as a migrant and a bilingual Arabic-speaking healthcare professional and man himself. I'll hand over to Faisal now to introduce himself. Having observed him in the chat all week, I'm very much looking forward to seeing him on the virtual stage. Faisal, you're very welcome. The stage is yours, my friend.
Thanks. I'm having a bit of issues trying to share my screen. How do I go about it?
Do you want to take over that, Melon?
Yeah, sure.
I guess I'll do that. Oh, hold on. So can you head down to the bottom of your screen? Are you on a laptop? Yep. Do you see the green share screen?
Yep.
Press that. Okay, what are we trying to get? Are we trying to get a PowerPoint?
Got a PowerPoint presentation.
All right. Can you see anything which is a tile there that has the PowerPoint in it or has the title?
Yes,
Microsoft PowerPoint? Yep. All right. Click on that one. You should get a nice little blue border around it. Share. You're already ahead of me. All right. You can see your screen.
All right. Look, thank you, everybody. Thank you, Glenn, for the introduction. I've been nursing since basically the mid-80s and have worked in diabetes and men's health across the country, basically, since 1990. My topic today is about men's health issues in a nutshell. And as nurses, what can we do? What have we done? And if there's any room for improvement and progress. Next, I'll have to push. Right. As a nurse working across the health continuum, my experience has been that men are a diverse collective with different values, different perspectives, different health needs, different outlook on how they perceive the goals and objectives in life specific to their health. With the exception of mental health issues, we often assume that men rarely or have a sort of an aversion for attending health services. To me, that's a bit of from my experience, not a valid or realistic one, because often I've come across a lot of men who are very diligent and very capable, very caring, and do really put a lot of input into their own health and management. again, from a nursing perspective, the mannerism and the process through which men often perceive their health is often divided by a number of intrinsic factors. And these could be their image or perceptions of masculinity, their behavior, cultural beliefs and practices, and socioeconomic norms and societal experiences and so on. So despite numerous advances in men's health over the past 30 years, really, we still continue to see that men still follow inappropriate behaviors. They are inactive. I mean, typical, as was mentioned earlier about the image of norm, that has really is continuous and has come through since I could remember working in nursing and in health issues. Again, one of the problems I have come across often is working in emergency. A lot of the presentations that I see or have seen is sometimes because of risky behavior, injuries, alcohol poisoning, and so on. So basically, the behavior is such that really it does not contribute or enable better health outcomes, or as well as it contributes to an increase in morbidity and mortality. Again, masculinity. I know that's a very debatable question, and often we have a lot of health professionals who go back to the issue and concept of masculinity as to why it undermines or underlies a lot of the behaviors of men. It is an important issue, and often it is understanding masculinity enables us to better understand how men behave and so on. And despite the numerous initiatives to facilitate better men's health outcomes, it wasn't until the 2010 federal government policy about men's health that we first learned to acknowledge and perceive men's health as a gender-specific issue and try to address the men's health needs, the barriers, the enablers, and so on. The National Men's Health Strategy 2020-2030 identifies 5 main issues. And as you see there, it's mental health, chronic conditions. Within that, we include diabetes, heart disease, musculoskeletal injury and poisoning, and so on. Reproductive and sexual health conditions, injury, and healthy aging. My perspective on this, or my observations over the past 30 years in working in nursing, is currently we're seeing men at a crossroad. One of the issues I've noticed, or anecdotally, my experience has been, as men age, there seems to appear a slow disregard, interest, and focus on how they manage their health and well-being. Again, you know, you wonder sometimes whether this consistent perspective of how they look at their own health and well-being, how they manage it, is it a stereotype? Is it to do with shortcomings? Is it to do with how they don't want to be seen in front of their mates and so on? But again, the issue of masculinity, the culture of men being a stoic, self-reliant, strong, unwavering against all odds, action-focused men, is driving us to the grave, or early grave, if I might say. Being a male is not without its trouble. Male gender is a significant and alarming risk for premature death, as I mentioned, not only within Anglo-Saxon speaking Australian, but also across cultural, socioeconomic, and especially at risk isolated groups, disadvantaged groups, CALD communities, Indigenous communities, and there's so much work done in Indigenous communities to prove that they are at risk, they are isolated, and we need to do more than just talk about Indigenous health and so on. And despite a variety of reasons to explain why men are reluctant to participate or engage with health services, there was a mention earlier that men need to feel safe, they need to feel confident, they need to feel that they are engaged with the health profession that they enter or are approaching for services and so on. And again, I think really we need to have a sound understanding and be aware of the various enablers and variables that determine, undermine masculinity and the Australian male stereotype. Sorry, I'm sitting here realizing I'm freezing cold. We've got 0 to 6 degrees up in the northeast Victoria, while back in Perth and in Queensland, they're enjoying a beautiful weather. Though Victoria is not that bad after all. It's a beautiful place to be. Look, the ever rate of increasing preventable diseases, health conditions, incidental injuries, risk-taking behaviors, and suicide among men is really a main issue that we need to focus in from a men's health perspective. Men are dying in great numbers, and some of the factors involved in that, as any nurse or male health nurse would tell you from working, whether in community settings, in emergencies, on the wards, there's a number of underlying factors, whether it's aggression, whether it's aggressive tendencies, risky behavior. Alcohol plays a big role, poor dietary practice, or obesity or overweight are a lot of major factors that really undermine, contribute, and really create the figures we're seeing now in terms of elevated morbidity and death in men's health. As we age, again, the issues in conditions determining and defining our poor health practices become more prominent, more dominant. And often you come across health services, as my experience. Like one example, recently, a friend of mine had to take his daughter to an emergency department because she was intoxicated. And the nurse who was there said, sorry, she's drunk, take her away. We don't want to deal with that. Bearing in mind, this young lady had consumed 30 alcoholic drinks within 2 hours. The same I've noticed occur with men or young men who drink to an excess, present to an emergency department as their first port of call, and often are turned away because of their behavior, because of the alcohol intake or the generalization about their behavior. And so what happens is this individual, this young fella, goes home, possibly suffers an adverse event, and then lost to manhood, or lost to the male population or the community. The key health challenges I see or I have come across really has to do with how we modify our lifestyle, how we change our behaviors, how we create better awareness, literacy, and viability. And I think this Men's Health Forum has contributed a lot to creating better awareness, understanding, networking, sharing. And I think we need to do more like programs, events like this to create a better understanding, because really we are losing too many men prematurely. We are basically seeing ourselves to the graves too early and in greater numbers than it should be. Some of it is because preventable and manageable disease. Some of it is because of behaviors. Some of it is because poor awareness and understanding. And you can't say that our literacy is lacking, because men's health literacy is very positive. It's out there. It's just some of our behaviors really need to be considered. The statistics that worries me or I find scary are that 7 out of 9 suicides a day in male. Death from injury in men is about 2.6 times more than that of females. Men die from chronic heart disease, lung cancer at twice the rate of that of females. So females are doing a far better job than we are, and maybe we should take some lessons from that. 3 out of every 4 men are either overweight and obese, with 20% of men more likely to be either overweight or obese. 1 in 2 men either live with or suffer from a chronic condition, whether it's diabetes, heart disease, lung cancer, and so on, or lung respiratory COPD or other respiratory disorders. More men are likely to be diagnosed with bowel cancers, yet far less men take up bowel cancer screening. There's 1 in 4 men who exceed their lifetime alcohol abuse and smoking risks. And it's been reported, my understanding, according to the recent data and statistics, that 1 in 4 men aged 16 to 24 have experienced a symptom of a mental health disorder. And when you look at it, about 1.5 million males 18 or over have reported or self-reported a mental or behavioral condition. So much has been said about suicide, and I know with day one has been fabulous, really, because it provided us with a lot of information, knowledge, initiatives on that we need to think about, absorb, and try to formulate into some action strategies to really minimize or reduce the impact of suicide on men. It's really interesting that I used to work about 15 years ago in suicide prevention in New South Wales Health. And I was tasked with working with CALD communities and to identify some of the variables impacting on the ever increasing number of suicide. And one of the things I found was that it really is still strong among CALD communities, but why we don't hear about it is because of cultural variables, because of the shame associated with it among CALD communities. It still proceeds on as a silent death. So their family might say to you, oh, sorry, it was sick cancer or something else. So we're really unable to identify the real causes that occur. We need to look at that because suicide represents different concepts for different people, different cultures. And as clinicians, we really need to understand the variety of ethnocultural norms, the health beliefs and practices that would enable us to really work better with them and hopefully minimize such risks and so on. My perspective is that the collective men's experience suggests that prevention, physical health and mental health and well-being, improvements and advocacies can be best achieved when there is open communication, when there's sharing and exchange of knowledge and ideas and concepts, when there is a collaborative participatory work to get together and work towards achieving the same goal. Let's not reinvent the wheel. Let's work together, share the ideas, work together and then promote. And I think the Australian Men's Health Forum is doing a marvelous job. I can also comment on a number of activities. I did mention InfoHealth in WA. Healthy Male is also another organization that really promotes sound evidence-based understanding on men's health issues. Again, my take-home message is communication, raising awareness, consultation and sharing of men's health burdens, enablers, lifestyles are really key point to moving us into the future. The health challenges I've noticed over the past 30 years working are still the same across the nursing continuum. As I said, I've had a fair experience working in emergency department. I work as a diabetes nurse consultant. I've worked in health promotion. And again, cardiovascular disease, infarcts and stroke are the main killers, are the very important issues to consider. Suicide, injury, self-harm, we talked about it a fair bit. Depression, other mental health conditions. Diabetes and chronic disease. Diabetes is a sweet killer. And often what I've come across is a lot of men come to me with problems associated or related to their diabetes 10, 15 years where they should have been identified and recognized earlier. Men-specific cancers, I know there is a beautiful session coming on later with the Prostate Foundation talking about prostate cancer, and I encourage everybody to attend that. Colorectal cancers, gastric ulcers. Men seems to have a higher prevalence of gastric ulcers, and whether that's due to stress, to the way we relate and deal with issues and so on. Again, the key men's health challenges I see or have noticed is integration of both sociocultural, biological variables which coupled with the image of Australian male or the culture of stoicism, emotional ambivalence, independence, self-reliance, is only doing us damage by serving to further alienate us from our roles as brothers, fathers, husbands, and so on. So I think we need to be a bit more conscious and aware. We need to share, we need to touch each other, we need to hug, talk, seeing your friend or your mate who's in a problem, ask them, are they okay? Initiate a conversation, and especially in terms of health professionals or clinical nurses. You often see somebody comes to you for a different problem. You really need to look holistically and try to identify some of these issues, refer them to the appropriate bodies, follow up, make sure that they are listened to, that they are heard, and there's some support mechanism going on. Again, the elements of men and physical shortfalls. I want to talk about 4 issues as health professionals or nurses. Majority of us are nurses. We can contribute to, we can participate and take the opportunity and discuss it with patients, with people we engage with, we talk to. Heart disease, diabetes, hypertension, erectile dysfunction. Heart disease, as I said, is a killer of men. 1 in 3 death causes in males. There's a very strong correlation between heart disease, diet, and inactivity. What can a man do? What can we do as men, as health professionals? Basically, adopt a healthy lifestyle, eat healthy, balanced food options, monitor your blood pressures, cholesterol, glucose levels if a diabetes person, minimize, reduce alcohol where possible to a safe level, manage stress, anxiety, engage, talk to your loved ones, talk to your friends, be open about issues, consult. We're all there together to help each other. Diabetes, there's highs and lows in diabetes, but basically, the way I look at it, it's a long but sweet road to heaven. It's takes us to our graveyards. Often you find diabetes is though it's considered as the 6th overall disease in health burdens and 7th contributing cause of death in men, it undermines a lot of the other chronic diseases, whether it's involved in heart disease, in renal failure, in amputation, in blindness, and so on. And some of the main issues that men really need to become very focused upon is that it undermines erectile dysfunction issues. And, you know, it's an outstanding issue that we need to consider. So what can we do? Healthy lifestyle, again, manage depression, look after yourselves, attend your GP. Hypertension. Yeah.
We're out of time, so I'm going to ask you to wrap up, please.
Okay, sure. So basically, we talked enough about erectile dysfunction. What I would like to say, though, is that the Healthy Male site, or what's formerly known as Andrology Australia, has got a dearth of information on erectile dysfunction, on men's health issues. I suggest that perhaps people would want to go back to that. Anybody wanting copies of my PowerPoint, I'm happy to share that. I'll send one to Glenn.
Thank you.
Thank you all.
Thank you, Faisal, for such a comprehensive talk and for bringing your many decades of experience of nursing and working with men to our Men's Health Connected event.